Well, the Art of Healing program that we've been working on, kind of the guidelines for it for the last few months. The idea has come out of a couple different, come from a couple different directions. One being the need to have a facility that is not such a stressful environment, something that's more calming and soothing and appealing to our patients and people in our community. But also, the other direction we're coming from is one in which we are taking part in a much broader, larger art movement within the community. We've been really impressed with how, our community has always kind of had a artsy bent to it, with having the Nescatonga Arts Festival as the longest running, continuously running arts festival in the state. And then, the Mural Society has been very active in our community, and now as we've kind of brought more of the art movement downtown with the different vendors down there, and then the new Graceful Arts Center, it's something that we've wanted to be a part of. We were very, pleased a few months back when Betty Jo Pangburn, was Betty Jo Bella, called and asked if we were interested in her husband's metalwork collection that we could display up here on campus, and that really kind of kicked things off for us. And when we got that, and we've refinished some of the pieces that were requiring refinishing, and then the others we've left as they were intended, their initial state is what it would be. It's kind of just taken off from there, and we have some pieces that we'll be showcasing out on the lawn, and with the Bella collection, and we'll be looking to create some consistency throughout our facility with other pieces of art, as well as signage and even volunteer and donor recognition type displays.
So how would you go about getting art for the center?
What we're initially going to do is we've kind of got a plan that you have in front of you there, and it outlines some different requirements that we'll have for the artwork, or the pieces of art, which make sure that we are able to maintain a clean environment. So certain materials aren't going to be appropriate. Fabrics and things of that nature will have to meet healthcare standards in order to be used in our facility. And some other issues such as that will help us determine what can be appropriate. But we've asked, we've got this plan which we intend to send out to area artists, experts in public art, and for them to submit proposals to us. So we're essentially saying our hospital and our campus is a blank slate for you. We've got some things that we need you to comply with, but make us look good. Give us a proposal, make us look good, make it be something that we want to carry out. And whatever they come up with in terms of artwork, it'll either be something we purchase, or that donors can contribute, or even we can have people make donations to our foundation, which will allow us to then make the purchase of those pieces. So we'll go about acquiring the works in several different ways, probably. Signage, hospitals, and in our proposal we call it navigational awareness. You know that every room has a sign outside. It's got a fire code on it, and a bunch of other stuff that we have to have by state health department codes. But signage essentially tells a person where they're at within the building. So, it's often something that in healthcare settings you're using jargon that people really don't understand, what it is that they're looking for based on what signage we have. So we're wanting with the signage plan to create something where if you're coming in for an x-ray, you don't have to understand that radiology is the place where x-rays occur. We'll set it up in a way that the signage creates a sense of navigational awareness. And, when I say we'll set it up, we're hoping for proposals that really just jump out at us, that'll make it easy for our patients and our community members to come in and navigate through our facility. Because one, most of the time when a patient comes into a hospital, they're probably under some other kind of stress related to their health. We don't want to add stress to that by them feeling lost within our place. You said it yourself when we were coming in here, wow, I hope I don't get lost. The signage is to help people understand where they are within our facility and get them in and out efficiently with as little concern as possible. Our staff decided what our signs needed to be when we put the signs up in the first place, and we know that while we might be good at taking care of people's health care, we have reason to believe that we could probably do a better job on signage. So that's why we have this proposal out to hopefully get us something that will be a little more customer friendly. We will be seeking proposals within the next few weeks. We look to hopefully within the next few months have those proposals evaluated and have one of them at least approved for implementation. We look to be kicking this off within the community shortly after that. And I think it's going to be an exciting thing for our community to get behind our medical center in yet another way. Our community has been very supportive of our medical center, over the past few years and even, long before that. So this will be a new and different way for the community to get involved with what's going on. And we're going to start with the hospital and then ultimately, in time, take this to all of our other campuses with the nursing home and then possibly the homestead. And it's, something, it's going to be a new trip for us, but we're excited to take the journey. So.